According to a new report, almost a third of recovered COVID-19 patients in a UK study ended up back in the hospital within 5 months, and up to 1 in 8 died of complications from the illness.
Joining us on the KOGO News Live line, cardiologist Dr. Fahmi Farah. Good morning, doctor.
Good morning.
So this is extremely disturbing. And what kind of health problems are these people having once they recover?
They're having many different types of health problems. For example, long-term complications with lungs. People who recovered from pneumonia related to COVID-19, they're having, chronic cough with shortness of breath. A lot of these patients are having what's called pulmonary fibrosis. They're essentially forming scar tissue in their lungs. There are other complications like, heart-related complications such as heart failure. That's a pretty serious complication to have to deal with in the long run. Many of the patients are also having kidney problems. A lot of them had, blood clots in their legs and their lungs. So there is just a wide variety of complications in many different parts of the body.
Is age or ethnicity playing a role in the complications?
Yes. For most people, it is the advanced age group, like 65 years and older. They're more susceptible to these complications in the short term as well as in the long term. But, now we are seeing many young people who fall into that category as well. So it is to some degree unpredictable.
All right. So, if you had COVID-19 and you recovered, what lifestyle changes do you need to make to, avoid this happening to you?
Prevention is key. So we need to continue to maintain social distancing, wearing masks, washing hands. That's the best way to prevent this virus. And now the vaccine is available. So for those who can get the vaccine, they should, as long as they don't have any contraindications to the vaccine. That's going to be a key way of prevention. In addition, they need to maintain a good immune health by eating healthy, heart-healthy, and immune-healthy diet. Exercising, maintaining a good exercise regimen is a good idea. And also keeping in touch with their doctors and minimizing their risk factors such as high blood pressure, diabetes. All those risk factors need to be under check. For those who have pre-existing conditions like heart disease, they need to make sure that they're following with their cardiologist and stay on top of their health.
All right. So let's talk about those who, though, have already had COVID. They've socially distanced, they've masked, they got it anyway. And it's, you're coming out of it. Is there a way to stave off getting those secondary illnesses or those complications?
In many cases, it's really not up to the individual whether they're going to end up with those long-term complications or not after they have received COVID. It really is, it depends on how the body handles it. A lot of people are having prolonged inflammatory phase. Many of them, even weeks after recovering from COVID, are getting very ill. And and this is even after the virus has left their bodies. They're having inflammatory reaction to it, causing pneumonia, shortness of breath, all sorts of things. So I don't think that part is in anybody's control. But to stay healthy by, the things that are in our control, such as some of the things that I mentioned, like, eating healthy, taking your medications, staying active is going to be a big part of it, because one of the things COVID is causing is debility. Because it's taking so long for some of the people to recover from it, they're becoming less active, and it's difficult for them to get back into routine. So it's going to be important to go through rehabilitation, like physical therapy and things like that, to get back into your routine as quickly as possible.
Dr. Fahmi Farah, thank you for joining us here on the KOGO News Live line. We appreciate the time and the information.